right. I think we're connected now to Facebook. Okay, great. So hello, everyone. Welcome to our live Q&A on the topic of ECG for you and me. My name is Pranam, and I will be your host today. And with that, I'd like to welcome back our special guest, Dr. Omar Baqal. Dr. Baqal is a resident physician at the Mayo Clinic and has deep interest in the area of cardiology and medical education. And in fact, he has a big international following where he's helping aspiring doctors navigate the US educational system, which is really cool. I wish I had somebody like that when I was doing my engineering, but no, it's always really helpful, especially when you're when you're outside the US, just, to navigate through all of this. So Dr. Baqal, we missed you. So can you share with our audience a bit about yourself and your research interests these days?
Well, Pranam, thanks for introducing me. And likewise, it's been a while since we spoke about an important health topic, and it's always nice, being here, having those conversations with you. I think you really introduced me very well. There's really not much else to add. I'm a resident at the Mayo Clinic, and as Pranam mentioned, my general interest, my area of particular interest is cardiovascular health. My research is mostly, around preventative cardiology and electrical and structural diseases of the heart. So, there's so much more we can do for our patients in terms of advancements in healthcare, advancements in diagnostics. And, it feels great being part of this movement where every day we're learning so much about our own cardiovascular health.
Yeah. Awesome. So for those of you who did not watch our previous live Q&A with Dr. Baqal, we actually spoke about our topic was diabetes and hypertension, which is another really interesting topic. So you can check it out anytime you want. It's on our YouTube channel. So also before we get started, disclaimer, any health-related information provided here is for informational purposes only and should not be used to replace the advice of your doctor. Right? So today's topic is ECG for you and me. And like diabetes, blood pressure, and weight, these days, even ECG is becoming more accessible, right? Like for all of us. In fact, I have one now on my wrist, and I can take an ECG whenever I want from my Apple Watch, and I can sync it directly to my app on SmartBP. And then I can share it with my doctor. But, unlike blood pressure and diabetes and, weight, where we have like a number and we have a goal that we're shooting for, the ECG signal is more abstract, right? Like, meaning in most cases, I mean, I see a wave, but I don't know what it's saying. Like, it's not saying it's good, bad, ugly, I don't know what it's saying. And therefore, we hope that with this live Q&A, Dr. Baqal can help demystify the electrical activity of the heart, which is our ECG. So Dr. Baqal, perhaps we can start off with a very basic question. What is an ECG or EKG? I think you can use them interchangeably, but in simple terms, what does it mean and why is it useful?
Yeah, of course. So, the heart's a muscle, but truly what makes sure our heart pumps in the way it does in a very well coordinated fashion is an electrical circuit in place. And there's a very, comprehensive electrical circuit in our heart, which starts with the heart's own pacemaker, the sinoatrial node, and then it conducts, the electricity down the heart. So our upper chambers contract first and the lower chambers contract next after a small bit of gap. So truly an EKG or ECG or electrocardiogram looks at that electrical circuit and looks at the different pieces in this in a contraction of a heart, the phase of contraction, and ensures that what we're looking at follows within the normal variation of electrical activity of the heart. As part of an EKG, the different bumps and spikes that we're looking at are different pieces and different phases of this contraction, different phases of this electrical activity passing down the heart. And truly, it helps us look at the health of the electrical conduction system. It helps us identify any structural conditions of the heart that might be creating abnormalities in the electrical activity. And truly, it's really one of our first go-tos when we have patients come in with with heart disease, or with rhythm disease, abnormal heart rhythms. So the EKG, although it's very difficult, it takes time to master an EKG, even for prominent established healthcare professionals. I think it really helps to understand the very basics of what an EKG tells us. So in very simple terms, it basically tells us about the electrical activity of the heart, because there's a very well coordinated way through which electrical activity passes down our heart, and an EKG helps us understand whether or not there are any issues that we're seeing with electrical activity.
I see. So yeah, as an engineer, this really fascinates me, because the heart, basically it's pumping. It's like a pump, right? And and over an average lifetime, it pumps over 1 billion times, a very reliable pump in most cases. And imagine that, a pump that works fine without any maintenance, like typical pumps. You're doing all your lubrication, you're replacing seals, tubes, filters, oil, clearing blockages. Yes, there are issues that bad things that can happen, right? And some of these failure modes of like a mechanical pump we deal with, is kind of analogous to the heart. And that's when we come to see doctors like yourself, right, to fix those type of issues. But mostly it works fine. So which is really cool. So if you can, throw some light on what is the ECG saying to us. Maybe I can just pull up a slide.
Yeah.
I put, something together to help you talk through.
Of course.
So let me just do that here in a second.
While Pranam pulls that up, I can give our attendees further insight into how an EKG reads what it reads, right? So if any of you have undergone an EKG, you'll notice that you get leads placed on your chest, on your arms, on your feet. And as an engineer, Pranam, I am sure you will appreciate the concept of a vector, a specific direction. So in a normal state, the electrical circuit or the electrical current is passing through our heart in a certain vector, in a certain direction, which is considered normal. And that's how we get those spikes and different aspects of our EKG on the EKG strip. So any abnormality in the electrical circuit will reflect as a change or a shift in vector in that direction through which the electrical current would normally pass. And that's when we start wondering if there are any abnormalities that we're seeing as part of the electrical circuit of the heart. So the vector is truly what I think forms the foundation of an EKG. When we see a change in vector, when we see a change in the direction of the electrical activity passing through the heart, that is one of the things that helps us pick certain abnormalities in the heart function. So I'm going to have Pranab.
I'm just searching for that slide. Oh my God.
That's okay.
I think I lost. I hope I don't. How do I find it here? Let me just try this again. Should have been here. Oh, there you go. Okay. It's opening up here. Give me a second. Sorry about this.
No worries.
Okay, so let me share my screen. And gosh, I don't see it here. Okay, here you go. All right. I hope this works. Are you able to see my screen with the heart?
Oh, yeah.
Giant heart.
Well, I can see
that.
I
just found this animation on Canva. I thought it was pretty cool. But yeah, this is like basically, I think what you really, So yeah.
Yeah, so I think that's an excellent diagram. It really helps us understand the different segments of an EKG, right? The core segments of an EKG. So these include the P wave, the QRS wave, and the T wave. Now, as I was mentioning, the EKG is picking up electrical activity in the heart. That means ions passing through our cell walls or the cell membranes, right? It's a transfer of electrical ions that creates electricity passing through the heart or any muscle or any cell that is. So let's go through the different segments of this EKG. I mentioned earlier that the upper chambers of the atria, the left and right atrium, they contract before the ventricles. And that's important because they start off by squeezing blood into the left ventricles, and then the left ventricles squeeze them out, right? The left ventricle squeezing blood to the rest of the body, and the right ventricle squeezing blood to the lungs to get oxygenated. So the P wave essentially highlights the atria contracting. And when we talk about electrical activity, we talk about it in terms of two terms. We talk about depolarization and then repolarization. Depolarization is really when the atria are contracting, when there's electricity passing through the atria. Repolarization is after that contraction, as that part of the heart is coming back to a resting phase. That is repolarization. So the P wave essentially highlights atria depolarization, which means electrical activity in the heart that is leading to the contraction, right? And then you see that before the P wave, between the P wave and the QRS, there's a small gap, and that is a normal degree of gap, which we call the PR interval. And that gap is important, and sometimes that gap gets prolonged, and that highlights certain problems with the heart. So there's that gap, and then after the gap, we have the QRS complex, and this truly highlights electrical activity in the ventricles, where the ventricles are contracting, right? And then after the QRS complex, you'll see there's another small gap, and then we have the T wave, and that small interval in between is called the QT interval. And again, if the QT interval is too prolonged, that can highlight certain abnormalities of the heart rhythm. And then the T wave really highlights ventricular repolarization. As I was mentioning, repolarization being when the ventricles are coming back to a resting state after getting electrically activated and after contracting. And different segments of the EKG tell us different things. For example, in a state of a heart attack, when we talk about STEMIs, STEMI is short for ST elevation myocardial infarction. And in a STEMI, we will see an elevation of the QT or the ST elevation, which starts from the end of the QRS complex to the T wave. So in a heart attack that leads to ST elevation, we'll see an elevation of that segment. So again, really different aspects of an EKG telling us different things about heart activity. And I think Pranam has nicely demonstrated, what we discussed with regards to the atria contracting, the ventricles contracting, and where blood goes and where blood comes from, when through these atria and the ventricles. So I hope that generally gives you an idea how the different parts of an EKG tell us different things about the heart activity and can highlight different abnormalities about a person's heart. We look at the rate at which a person's heart is beating. We look at the rhythm. Normally we expect to see a regular rhythm where those segments in EKG are occurring regularly. If there is any irregularity, we suspect there may be an abnormality with the electrical activity in the heart. So here Pranam has nicely demonstrated a sinus rhythm at 64 beats per minute, which is a normal rate, a normal rhythm.
Okay. Yeah. So maybe just a quick question here. So basically this is an electrical signal, right? So it's essentially we're measuring this electrical signal, which is basically saying how we are firing up, those electrical signals. So like you mentioned, there's those nodes, the SA node and the AV node. And basically what that does is it basically, excites the muscles in this atrium and this ventricles to like you mentioned earlier, sort of synchronize in a very nice synchronized fashion to sort of pump the, pump oxygenated blood into the body, like bring deoxygenated blood, which is, so our body is consuming all this oxygen, and then all of that comes in here, it gets pumped into the lungs, and then the lungs oxygenates it, and because we're breathing, so the oxygen mixes with the blood, and then it goes back here, and then this oxygenated blood gets pumped into the rest of the body, and the way that pumping synchronization is basically happening. This gives us a window into the pumping synchronization. Is that correct?
Yeah, no, I think you described it pretty well. I just want to make two other points. So I was earlier mentioning a vector. So in normal circumstances, we expect electrical activity to pass through the heart in a certain direction, right? There's a direction through which activity is passing. If there's any deviation in that normal direction in which electrical activity is passing, that's going to reflect on the EKG. And then that can tell us different things about whether there are any abnormalities in this electrical conduction system that could be causing this deviation of the vector. So for example, you'd see, instead of this upright bump of a P wave, you might see inverted P waves, or the T waves might be inverted, or the QRS complexes may not be as tall, they may be short. So all these things will tell us different things about the electrical conduction system. And you'll notice that normally, we get a 12 lead EKG if someone's in the hospital or in the clinic. And different leads on an EKG gives us visualization of different areas of the heart. For example, if someone is having an inferior wall or inferior heart attack, those changes will reflect in the leads 2, 3 AVF. If someone's having a heart attack, on the more anterior frontal side, those will be reflected in the chest leads like V1, V2, V3. If someone's having a heart attack in the side of the heart, they will reflect in the lateral leads like 1 and AVL. So different leads on the EKG give us visualization of different regions of the heart.
Very nice. So funny story. So you mentioned about the inverted signals. So I was playing around with my Apple Watch and I put it on my daughter, my 4-year-old daughter, and I was trying to measure her ECG. And I noticed like inverted waves for the QRS, and I started freaking out. And I immediately contacted a close friend of mine who's like an expert. He's got like a lot of patents and papers on like ECGs, and he's like a super expert in this area. And he's like, dude, I think you put the watch in the wrong hand. And then I just swapped the watch on her other hand, and it was fine,
Yep.
So it's this a few little caveats here.
Absolutely.
But yeah, that was fantastic. Thank you so much. So like basically it's heart attacks, myocardial infarction, like those are the main things, right? Like, is there anything else like that the ECG is telling us?
There's actually a lot that an EKG can tell us. Sometimes electrolyte abnormalities, if someone has a low potassium, certain electrolyte abnormalities, they can cause prolongation of certain intervals in the heart. So besides heart attacks, conduction abnormalities like abnormal heart rhythms, atrial fibrillation, atrial flutter, more severe form of abnormal heart rhythm being ventricular tachycardia or ventricular fibrillation, all these will reflect on an EKG. If someone has fibrosis or abnormality in the heart muscle, some conditions like sarcoidosis or amyloidosis, where there's deposition of protein and deposition of fibrous tissue in the heart muscle, those will reflect on an EKG. So these are some of the things I can think of, but truly, the possibilities are endless. And even when we talk about conduction abnormalities, in addition to the few I mentioned, we can also pick up abnormalities of the AV node. So the AV node is another part of our heart which conducts the electricity from the upper chambers to the lower chambers. Sometimes there can be something we call a heart block, and there are different degrees of heart block, ranging from 1st degree to 3rd degree, 3rd degree being the most severe. So these are abnormalities we also pick up in an EKG. Just to give you an idea, a 3rd degree heart block would be when electricity is just not passing between the atria, upper chambers, and the lower chambers, which ends up creating this situation where the upper chambers are beating independently of the lower chambers. There's no communication, and that can be a dangerous situation, and we take that very seriously. So really, these are some of the things that come to my mind, that I can think of that really highlight the importance of an EKG and the things that it can tell us.
And based on that, your treatment would be like a pacemaker or ablation or something like that. Is that correct?
So usually when we talk about pacemakers and ablation, we're thinking about an abnormal heart rhythm. that cannot be reversed simply with electrolyte repletion with other things. Sometimes there are reversible causes of abnormal heart rhythm, right? But that is a far more complex discussion where we look at how much of a burden does this patient have of this abnormal heart rhythm? Are they symptomatic? Is it affecting their heart function and other things? So it is truly the electrophysiologists or the cardiologists who specialize in heart rhythm that make that determination whether a patient needs an ablation, if they would benefit from a pacemaker, if they can be managed on antiarrhythmic medications that control those abnormal heart rhythms. So, there's a lot of research, a lot of studies being done on this. And at the end of the day, there are a lot of different patient factors that we take into consideration to make that determination as to what treatment, what management approach would be best for the patient.
I see. So, unlike before where, ECGs was measured in the clinic, like we spoke about briefly about this before, unlike, in the past, ECG was only like the special thing that you could do in a clinic or a hospital. Now it's more common, right? So where do you see this going? Like, do you increasingly see patients coming with their ECG, on their watch and, basically measured from their watch and sending it to you, texting it to you, or, is it the primary care physician or the cardiologist that, finds the ECG useful?
That's a good question, Pranam. I think things have changed so much. Just to give you some context, historical context, William Einthoven back in the early 1900s was one of the pioneers of EKG, right, or studying the electrical activity of the heart. And he built on some work that was done before him. And then later on, it was a London-based medical equipment company that put together the first machine that read electrical heart activity. And that weighed 600 pounds. So that was the first known machine that we had to study the heart's electrical activity. So you can only imagine how far we've come, with regards to better understanding the electrical activity of our heart. And yes, in addition to outpatient setting, we have patients we see in the emergency department, or we see patients who come in after their smartwatch alerted them of an atrial fibrillation rhythm, right? Because the thing about some abnormal heart rhythms is that they can be asymptomatic, but patients will be in that. And if patients stay in an abnormal heart rhythm like an atrial fibrillation at a very fast heart rate for a long time, it can decrease their heart function. It can have treatment implications, right? So it becomes very important to, have something like that is able to alert you of an abnormal heart rhythm if you're in it. And yes, I've seen patients myself who come in who are like, hey, my watch alerted me of an atrial fibrillation rhythm going at 150 beats per minute. I didn't know, I didn't feel it myself, but my, watch alerted me, so I decided to come in. And we're seeing that more and more often. Now, as part of your second part of your question, even a general practitioner should be equipped to pick up obvious abnormalities in the heart rhythm. What I have to say is quite often we've also seen that the smartwatches are generally good at picking up abnormal heart rhythm, but they may not be able to distinguish between different complex abnormal heart rhythms, right? Recently I saw a patient who came in with an abnormal heart rhythm, and the watch had labeled it as atrial fibrillation, but the rhythm the patient was in was not atrial fibrillation. It was a different kind of heart rhythm, abnormal heart rhythm, but it wasn't atrial fibrillation. So I guess, as a starting point, as a screening point where patients are at least able to detect abnormal heart rhythm, I think it really helps in ensuring that, if there's any treatment that they need, it's detected early on and treatment is started early on. So I think that's one of the main benefits of this, wearable devices that we have to detect abnormal heart rhythm. And now, in addition to the wearable technology that is advancing so quickly, we're also seeing an advancement in AI, in artificial intelligence. I know at Mayo Clinic, there's so much work and investment being done in the field of artificial intelligence. So we're coming to a point where simply looking at an EKG, even though it may appear normal with no obvious abnormalities, AI is helping us detect the probability of a patient having atrial fibrillation by looking at, basically by utilizing the concept of machine learning, right? So this is an AI system that reads hundreds of thousands of EKGs, is able to kind of absorb that into its knowledge base, and then it's able to give us information that the human eye may not be able to pick up based on one EKG. So I think AI coupled with wearable technology, I think we're looking at a lot of promising things going forward. And I think it's a good place to start if patients discuss their heart rhythm, if there are any concerns with abnormal heart rhythm, with their primary care physician. I think the primary care physician should be able to nicely advise them of what they see on their heart rhythm and whether they need further cardiology evaluation.
Yeah, that's a great point. I mean, even like just to get the conversation started, right? Like, it doesn't have to be like, okay, we see this and immediately put you on 20 drugs and put you in an operation table and do all sorts of it's at least you can have like that conversation saying, hey, I noticed this, I made this observation, I was doing this activity and I suddenly felt a little fatigue or something, and I noticed like immediately my Apple Watch detected something.
Yeah, absolutely.
Yeah. All right, I think we're oh my god, we're almost almost out of time here. Let's see if we have some questions from the audience. Okay, there's one question here. What looks like a question is about stress. Like, so what is do you see an impact of stress on heart health? Can you?
Generally, obviously, there's the understanding that chronic, ongoing, long-term stress can increase risk of cardiovascular disease, right? And when we think about, abnormal heart rhythm, like atrial fibrillation, there are certain features in a person's heart structurally that can increase their risk of stress, but then there are other stressors on their body that can increase the risk of someone having abnormal heart rhythm. So when we talk about atrial fibrillation, drinking alcohol, smoking, someone who has sleep apnea or obstructive sleep apnea, that can increase someone's risk of atrial fibrillation. So all these contribute to stressors on the body. All these can increase the risk of cardiovascular disease, can also increase the risk of abnormal heart rhythms. And I think, stress generally, you would expect, the possibility of comorbidity, psychological comorbidities like anxiety, depression, and how they can impose a significant degree of stress on the heart, physiological stress, even more than, mental stress. And these can reflect, from a cardiovascular standpoint.
Yeah. And even like, I'm just thinking like from mental stress and, you can even, lifestyle, there's so many lifestyle changes that happen, right? When a person is very stressful, maybe their dietary intake, alcohol intake, maybe drug abuse, smoking.
Yeah.
These all could increase. Yeah.
Yeah, no, absolutely. I think you made a very good point. With stress come several other risk factors that further increase someone's risk of cardiovascular disease, right? And these are mostly modifiable, which means we can do something about those things. And I think that's where the primary care physicians come in, where there's so much emphasis on advising, on counseling patients about healthy habits, healthy lifestyle habits, because those can go a very long way in ensuring good heart health.
Thanks. So any more questions from our audience? You mentioned about stress, right? Like, so increasingly, we're also with wearables, we're measuring our heart rate variability, right? And I read some studies where there's a relationship where they say, okay, if your heart rate variability is increasing, that's a good sign. That means that it suggests less stress. What are your thoughts on that? Do you think it's useful to track heart rate variability?
I think it's a good question, Pranam. So heart rate variability, or HRV, is one such metric that's thought to be a very old metric, but now has gained, more interest in recent times. And what does heart rate variability mean? Heart rate being the number of time your heart is beating in a minute. And heart rate variability is basically this beat to beat variation in someone's heart rate. And the understanding is that heart rate variability may reflect a person's resilience and adaptability. Because keep in mind, a big aspect of what dictates our heart rate is our nervous system, right? We have the sympathetic and the parasympathetic nervous system, where the sympathetic nervous system prepares us for a fight or flight response, and the parasympathetic nervous system is able to bring that heart rate back down, right? So the understanding is that in states of stress, where someone may have ongoing stress, someone may have psychiatric comorbidities like mental, like depression, like anxiety, those can increase a person's baseline heart rate. And the higher the heart rate, usually we see that the heart rate variability decreases. So, heart rate variability, generally the concept is that the body is able to make those very small changes as a means of adapting to the needs of the body, the changing environment, changing stimuli in our surroundings. And that is seen as an indication of good health, good heart health. Now, it doesn't mean that, if someone has low heart rate variability, there's a medical emergency. It quite often does not reflect that. And also at the same time, high heart rate variability isn't always good, especially if it is in the setting of an abnormal heart rhythm like atrial fibrillation. So patients with atrial fibrillation can have high heart rate variability. But I think it's one of those things that we're able to factor in when we're counseling patients about their heart health. And if they have a low heart rate variability, we want to identify potential contributing factors, if there's anything that can be done about it. And again, adding that extra piece of information to counseling when we're counseling patients about the lifestyle modifications that they need to make, or what they could change in the way of improving their heart health, basically.
Awesome. Dr. Baqal, so thank you so much. We're already 3 minutes over our time here. It's always a great pleasure talking to you, and thank you so much for taking your time and sharing your knowledge with us. And hope to see you soon. But do you want to share anything else with the audience, or?
Well, Pranav, it's always nice being here, and thank you for having me. I think we had a very good conversation. It's all a matter of raising awareness about heart health, and there's a lot we can do in the way of awareness, in the way of education. And I think this is one such platform, through which we can ensure that people understand their heart health better, they can understand heart disease better. And I think people should never hesitate in asking their providers, their primary care physician, questions to understand those things better and how they can further optimize their health. So thank you so much, Pranav, and I really look forward to continuing this conversation.
Thank you so much. Thank you all for joining us in this live Q&A. If you're enjoying this content and you find it useful, please download our app, SmartBP and GlucoBite. SmartBP is an app that helps people manage their blood pressure. GlucoBite is an app that helps you manage diabetes. They're all in the app stores, and they're both free. So please try them out. Also, subscribe to our YouTube channel and like us on Facebook. All right. Cheers, everyone. Have a great rest of your day. And thank you so much. Thank you, Dr. Baqal. Thanks.
Thank you. Take care.